syndromes who have asymptomatic malrotations who get operations is remarkably high. It's between 30 and 50% of patients have a major complication associated with that. And the other subtle question, again, is I said think about classifying it. This is I would classify this, if we go back on one image, as an atypical malrotation with a low-lying ligament of Treitz, and there is some data out there that those patients actually have a lower risk of volvulus.
Now, your point about the meds throws me off a little bit, so that's a good point.
Sorry about that.
I'm not smart enough to think on the fly like this. So, no, but the patient, I said I'm going to go in. If I see evidence of a cause for this vomiting, such as impressive LADS bands, evidence of a dilated duodenum, something that would tell me that there's some obstructive process, then I'll relieve it and that's it. But if I go in and I see no real cause for why this child would be vomiting, because I agree it's not going to be a volvulus.
There was never a case where the vessels were normal in a patient who had a risk for volvulus, a narrow-based mesentery.
Really?
So we use it as a screening test in patients who are really sick, they've got peritonitis. You want to make sure that it's not midgut volvulus. If you do an ultrasound and you see normal orientation, at least in our experience in our series, there was never a case where it was volvulus.
Because that's different from some of the other literature says that you can have a normal ultrasound and be volvulized.